Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. My dear students, today I'm going to talk about vasomotor rhinitis and other types of rhinitis. Vasomotor rhinitis and other types of rhinitis come under the term non-allergic type of rhinitis. The term non-allergic rhinitis is commonly applied to a diagnosis of any nasal condition in which the symptoms are identical to those seen in allergic rhinitis, but an allergic etiology has been excluded. They occur more frequently in adults than in children. It's more likely to be perennial than seasonal. Well, there are certain types of non-allergic type of perennial rhinitis, such as vasomotor rhinitis, infected type of rhinitis, rhinitis associated with physical or chemical factors, drug-induced rhinitis, food-induced rhinitis, NARES, rhinitis of pregnancy, and atrophic rhinitis. First of all, talking about vasomotor rhinitis, which is also called perennial non-allergic rhinitis or intrinsic type of rhinitis. Now, in this type of rhinitis, clinically it resembles allergic type of rhinitis. Whereas when we conduct the tests of nasal allergy, they come out negative. It's a chronic type of rhinitis which usually occurs in the third or fourth decade of life. If we compare the clinical picture of allergic rhinitis with vasomotor rhinitis, allergic type of rhinitis we have already talked about in a previous lecture. There is a lot of sneezing and nasal itching, which is highly suggestive of allergic rhinitis, whereas it is more common in childhood. Whereas when we talk about vasomotor rhinitis, it causes more of hyposmia and nasal congestion, and the rhinitis it develops in adults more commonly. The pathophysiology of non-allergic type of rhinitis, and more so in vasomotor rhinitis, the etiology is unknown. As everybody knows, there is a rich blood supply to the nasal mucosa. There is sympathetic stimulation, which causes vasoconstriction and mucosal shrinkage, and there is parasympathetic stimulation, normally, which causes vasodilation and engorgement. Now, in vasomotor type of rhinitis, parasympathetic overactivity leads to the cause of the condition. It leads to excessive secretions from the nasal glands. Now, the pathology, the exact pathology of vasomotor rhinitis, there is instability in autonomic control. There is instability in autonomic control, and nasal mucosa is hyperactive and responds to several non-specific stimuli. For example, temperature, humidity, air blasts, dust, smoke. They all can lead to hyperreactivity of the nasal mucosa and the development of vasomotor rhinitis. As far as clinical features of vasomotor rhinitis is concerned, there is paroxysmal sneezing, bouts just after getting up from bed, excessive rhinorrhea. It accompanies sneezing or maybe a predominant symptom. It can be profuse and watery. Leaning forward, drips from nose. Nasal obstruction also occurs in cases of vasomotor rhinitis. It alternates from side to side and more common on the dependent side, whereas throat and nasal itching is also very common in vasomotor rhinitis, and there are frequent nasal infections which are superimposed on the vasomotor type of rhinitis. This is a picture of normal nasal lateral wall mucosa, which one can see there is no inflammation of the turbinates, whereas the turbinates in vasomotor rhinitis are quite inflamed. On anterior rhinoscopy, the inferior turbinate can be very swollen and boggy and sometimes congested. Other times it could be normal in color. How do we diagnose a case of vasomotor rhinitis? Typically, it's from the history. And then when tests are carried out, such as skin allergy tests, they show negative allergen tests, and there is no elevated immunoglobulin E in vasomotor rhinitis. Now, if the vasomotor rhinitis stands for a long duration, it leads to sometimes nasal polypi formation, hypertrophic rhinitis, and sometimes sinusitis as well. How do we treat vasomotor rhinitis? First of all, we try medical treatment in which we try to avoid provoking factors. Then antihistamines and oral nasal decongestants for sneezing and rhinorrhea, whereas topical steroids in the form of spray or aerosol like beclomethasone or flunisolide or fluticasone spray, they all help. Systemic steroids, they're not commonly given to patients of vasomotor rhinitis, whereas sometimes if it's a severe case of vasomotor rhinitis, one may go for a short-term treatment with systemic steroids for, say, a week to 10 days in the form of prednisolone tablets. Now, removal of psychological factors is also important, since we know that vasomotor rhinitis is due to the instability of autonomic nervous system. Tranquilizers may also be needed to calm and quieten the patient, and that helps in the treatment of vasomotor rhinitis. Now, sometimes medical treatment does not help in the relief from symptoms. For example, nasal obstruction, if it's not relieved by medication, then we have to go for reducing the size of turbinates, especially the inferior turbinates. And how do we reduce the size of turbinates? Sometimes it's just electrocautery, by which we cauterize the inferior turbinates mucosa, that shrinks and relieves the patient for a little while. whereas other types like diathermy to the inferior turbinate mucosa or submucosal diathermy to the inferior turbinate mucosa also helps to reduce the size of the turbinates, and in that way it helps to relieve the nasal obstruction. Causes like polyps or a deviated nasal septum, they all need to get appropriate treatment. Vidian neurectomy is a procedure for excessive rhinorrhea, not controlled by medical treatment. In this case, we section the parasympathetic nerve fibers of the nose. We all know that it's the Vidian nerve which supplies parasympathetic supply to the nasal mucosal glands, and sectioning the nerve can obliterate that pathway and lead to reduction of the secretions. Now this is the anatomy of the nasal mucosa and the nerve supply. It shows clearly the Vidian nerve being formed by two nerves. One comes from the greater superficial petrosal branch, which is parasympathetic supply, and one comes from the deep petrosal nerve, which is the sympathetic supply. They together form the Vidian nerve to the nasal glands. Now, talking about other types of rhinitis, which are non-allergic, one talks about hormonal type of rhinitis. In this case, estrogens cause vascular engorgement in the nasal mucosa, leading to nasal obstruction and or nasal hypersecretion, leading to rhinorrhea. Whereas emotionally induced rhinitis is another type of non-allergic rhinitis. In this case, emotional factors such as stress have been documented to affect the nose as a result of autonomic stimulation. Other type, honeymoon rhinitis, usually follows sexual excitement leading to nasal stuffiness, nasal obstruction. Another type is food-induced rhinitis. In this type, spicy and pungent food may in some people produce rhinorrhea, nasal stuffiness, lacrimation, sweating, and even flushing of face. This is a cholinergic response to stimulation of sensory receptors on the palate. Spicy food, particularly the red pepper, contains capsaicin, which is known to stimulate sensory nerves. It can be relieved by ipratropium bromide nasal spray, an anticholinergic, a few minutes before meals. Yet another type of non-allergic rhinitis is drug-induced rhinitis. In this case, several commonly employed medications such as aspirin, non-steroidal anti-inflammatory drugs, beta blockers, angiotensin-converting enzyme, ACE inhibitors, methyl dopa, oral contraceptives, psychotropic agents, and nasal topical decongestants may induce symptoms of rhinitis when they are administered either topically or systemically. Another type of rhinitis is rhinitis medicamentosa. In this case, persistent overuse of the topical nasal vasoconstrictors lead to nasal decongestion and by a mechanism involving a rebound effect. Following withdrawal of these drugs, excessive use of these agents lead to nasal hyperreactivity and hypertrophy of the nasal mucosa, known as rhinitis medicamentosa. Now, anterior rhinoscopy in this rhinitis medicamentosa case shows overused decongestant nose drop induced rhinitis with sinusitis. Another picture of the inferior turbinates, swollen, bluish purple looking. Yet another type of non-allergic rhinitis is NARES, which is non-allergic rhinitis with eosinophilia. Now, in this condition, there is presence of more than 20% of eosinophils in nasal smears of symptomatic patient with perennial sneezing attacks, profuse watery rhinorrhea, nasal pruritus, incomplete nasal obstruction, and often loss of smell. Marked feature is lack of evidence of allergy, as indicated by negative skin allergy tests and absence of serum immunoglobulin E antibodies to specific allergens. Rhinitis SICCA. It is a crust-forming disease seen in patients who work in hot, dry, and dusty surroundings. For example, bakers, iron and goldsmith workers. Iron and goldsmiths. Now, condition is confined to the anterior third of nose, particularly of the nasal septum. The ciliated columnar epithelium undergoes squamous metaplasia with atrophy of seromucinous glands. Crusts form on the anterior part of the septum, and their removal causes ulceration and epistaxis and may lead to septal perforation. Well, that's all about vasomotor and other types of rhinitis. Thank you very much.